Welcome to the deep dive. Today we're tackling a topic that many cat lovers might face, or maybe you just want to understand it better. Feline diabetes mellitus.
Yeah, it's quite common actually.
Right. We've sifted through some really good veterinary info, and our goal here is simple. Give you a clear picture of this condition in cats.
What causes it, how you might spot it.
Exactly. How vets diagnose it, treatment options, and, what life can look like for a diabetic cat. We're aiming for those aha moments, but without getting bogged down in super technical jargon.
Definitely. We're zeroing in on feline diabetes, or DM as it's often called, just to really get the essentials down. It's all about understanding this endocrine disorder based on what the science tells us.
Okay, let's jump right in then. What exactly is feline diabetes? What are we talking about here?
Well, at its core, feline diabetes mellitus is an endocrine disorder. That means it involves hormones, right?
Uh-huh. Hormones.
And the main issue here is chronic hyperglycemia. That's just, persistent or high levels of glucose sugar in the blood.
Okay, high blood sugar. Why does that happen?
It happens because either the cat's body isn't making enough insulin, which is the hormone that controls blood sugar, or the cells in their body aren't responding properly to the insulin that is there.
Ah.
That lack of response, that's called insulin resistance. And, well, often it's actually a mix of both not enough insulin and the body resisting it.
Endocrine disorder, insulin resistance. That definitely rings a bell. Isn't that sort of similar to type 2 diabetes in people?
That's a really sharp observation.
Yeah.
Yes, actually, most cases of feline diabetes are very much like type 2 diabetes in humans.
Oh, interesting. How so?
Well, it's usually not the cat's immune system attacking the pancreas cells that make insulin. That's more like type Y. Instead, it's this situation where the body becomes less sensitive to insulin.
Right.
And the pancreas might struggle to produce enough extra insulin to compensate. It's fascinating, actually, on a cellular level, the patterns of decreased insulin receptor sensitivity in fat and muscle. They look pretty similar in humans and cats with this type of diabetes.
Wow. Suggests some deep-rooted metabolic pathways are involved then.
Exactly.
So, what makes one cat more likely to get this than another? What are the main risk factors we should know about?
It's complicated, of course, but some things definitely stand out. Obesity is, well, it's a huge one.
Yeah, I've heard that.
Think about it, that extra body fat isn't just passive. It actually releases hormones and inflammatory stuff that can directly mess with how insulin works, making the body less responsive.
Okay, so weight is key. What else?
It's not just weight, though. Getting older is another big risk factor. Also, being male seems to increase the odds slightly.
Really? Male cats?
Yeah, and also just not getting much physical activity. And believe it or not, genetics can play a role, too. Burmese cats, for instance, are known to be at higher risk.
Huh. Burmese cats. Okay. So keeping our cats lean is important, but other factors are definitely involved too. Let's dig a bit deeper into how this actually, works in the body. The pathophysiology.
Right, how it happens,
Yes.
pathophysiology, yeah. It really centers on that insulin resistance we mentioned. Okay.
So when the body's cells don't respond well to insulin, glucose can't easily get out of the bloodstream and into the cells where it's needed for energy.
So it just builds up in the blood.
Exactly. That's the hyperglycemia. And what's kind of insidious is that this constant high blood sugar plus the pancreas working overtime, trying to pump out more insulin, well, that can actually damage the insulin-producing cell, the beta cells in the pancreas over time.
Oh, wow.
Yeah, it becomes this sort of vicious cycle. The resistance makes the pancreas work harder, which can damage it, leading to less insulin production, which makes the blood sugar even harder to control.
That does sound like a problematic loop. So if this process is underway, what are the signs a cat owner might actually see? What should you be looking out for?
There are some really classic signs. Probably the most common are polydipsia and polyuria.
Okay, big words. What do they mean?
Yeah. Polydipsia means increased thirst, and polyuria means increased urination. They go hand in hand.
Why does that happen? It happens because those high glucose levels in the blood spill over into the urine when the kidneys can't reabsorb it all.
Ah, okay.
And sugar in the urine pulls water out with it. That's a process called osmotic diuresis. So the cat pees more volume, gets dehydrated, and then drinks more to compensate.
Got it. So more drinking, more peeing. That's a big one. What else?
Another key sign, maybe counterintuitive, is polyphagia, increased appetite.
Wait, they eat more, even with high blood sugar.
Yeah, it seems odd, right? But remember, the glucose isn't getting into the cells properly, so the body's cells are essentially starving, even though there's plenty of fuel in the blood. The cat feels hungry and eats more, trying to get energy.
But does eating more help?
Not really, because the underlying problem is still there. And despite eating more, many diabetic cats actually lose weight.
Eating more but losing weight, that sounds like a definite red flag.
It absolutely is. The body starts breaking down its own fat and muscle tissue for energy because it can't use the glucose effectively.
That's worrying. Are there other signs besides the thirst, urination, appetite, and weight changes?
Yes. Sometimes you might see neurological signs. The most characteristic one is something called peripheral neuropathy.
Neuropathy.
Nerve damage.
Exactly. Nerve damage caused by the chronic high blood sugar. It often shows up as a specific way of walking called a plantigrade stance.
Plantigrade stance.
Yeah. Instead of walking up on their toes like cats normally do, they might walk flatter on their back feet, sometimes with their ankles or hocks actually touching the ground. It looks a bit like they're walking like a rabbit or a bear on their hind legs.
Huh. I'll have to picture that. So walking funny on the back legs.
Right. And you might also just notice more general signs like the cat seems tired, lethargic, less active than usual.
Okay, so knowing these signs is crucial. But how do vets actually pin down the diagnosis? How do they confirm it's definitely diabetes? Good question. The diagnosis relies on a few key pieces of evidence. The main thing is finding persistent hyperglycemia, consistently high blood sugar levels, especially when the cat hasn't eaten recently, fasting.
How high is high?
Typically, we're looking at levels over, say, 300 milligrams per deciliter, sometimes even higher.
Okay.
And alongside that, vets will almost always find glycosuria, glucose or sugar, in the urine sample. That confirms the blood sugar has been high enough to spill over past what the kidneys can handle.
Right. But I've heard cats can get stressed at the vet, and stress can raise blood sugar temporarily, can it? How do you tell that apart from real diabetes?
That is a very important point. Stress hyperglycemia is definitely a thing in cats. A single high reading at the vet clinic could just be stress.
So how do you sort that out?
This is where a test called fructosamine comes in really handy. Think of blood glucose, like the weather. It can change quickly day to day or even hour to hour, especially with stress. Fructosamine, on the other hand, is more like the climate. It gives you an average picture of blood sugar control over the previous 2 to 3 weeks.
How does it do that?
Fructosamine is a protein in the blood that glucose molecules stick to over time. By measuring how much glucose is stuck to it, we get a sense of the average blood sugar level during that longer period.
Ah, clever. So it smooths out the short-term bumps caused by stress.
Exactly. If the fructosamine level is high, it strongly suggests the cat has had persistently high blood sugar, pointing towards true diabetes rather than just a temporary stress reaction.
That makes a lot of sense. A longer-term view. Okay, so let's say the diagnosis is confirmed. The cat has diabetes. What happens next? What's the management plan look like?
Managing feline diabetes usually involves a multi-pronged approach. Diet is absolutely critical.
Right. Diet. What kind of diet?
Generally, the recommendation is for a diet that's high in protein and low in carbohydrates.
Why that specific combination?
Well, carbohydrates break down into sugars quickly, causing spikes in blood glucose after meals. Limiting carbs helps minimize those spikes. High protein seems to help with satiety and maintaining muscle mass, and some studies suggest it might improve insulin sensitivity too.
Okay. Low carb, high protein diet. Makes sense. What about medication? Is insulin always needed?
For most diabetic cats, yes, insulin therapy is a cornerstone of treatment.
What kind of insulin?
Usually, long-acting insulins are preferred, things like Glargine or detemir or PZI protamine zinc insulin. The goal is to provide a steady background level of insulin throughout the day.
And how do you know how much to give?
That's the tricky part. The dosage has to be carefully tailored to the individual cat and adjusted based on how their blood sugar responds. This usually requires regular monitoring.
Monitoring? You mean like blood tests?
Yes, often involving the owner learning how to check their cat's blood glucose levels at home using a little glucometer, similar to what human diabetics use. Or sometimes continuous glucose monitors are used now too.
Wow, that sounds like a big commitment for the owner, checking blood sugar at home.
It definitely is. It takes dedication, patience, and working closely with the vet. But it's often the best way to get really good control.
And what about those overweight cats we talked about? Does losing weight help manage the diabetes itself?
Oh, absolutely. For diabetic cats carrying extra weight, weight management is incredibly important. Even modest weight loss can significantly improve their insulin sensitivity.
Meaning they might need less insulin.
Exactly. Their body starts responding better to the insulin they do have, whether it's their own or the injected insulin. In some lucky cases, especially with early diagnosis, aggressive dietary management, and weight loss, Cats can even go into diabetic remission.
Remission, you mean they might not need insulin anymore?
Correct. It's not guaranteed and it doesn't happen for every cat, but it's a possibility, particularly if the diabetes is caught and managed well early on. We've definitely seen cases where losing even 10% of their body weight makes a massive difference.
That's really encouraging, a chance for remission. But I guess even with good management, things can still go wrong sometimes. Are there potential complications?
Unfortunately, yes. Complications can happen, especially if the diabetes isn't well regulated, or sometimes just due to the nature of the disease. One of the most serious is diabetic ketoacidosis, or DKA.
DKA, that sounds bad.
It is. It's a genuine medical emergency.
Oh.
It happens when the body, desperate for fuel because it can't use glucose, starts breaking down fat extremely rapidly.
Okay.
This process produces acidic byproducts called ketones, which build up in the blood, making it acidic. Cats with DKA are usually profoundly ill vomiting, severe dehydration, lethargy, maybe a strange smell to their breath, altered mental status.
Yeah.
It requires immediate, intensive veterinary care.
Wow, okay. Definitely something to be aware of. What about the other things, like that walking issue?
The peripheral neuropathy, causing the plantigrade stance, yes, that can persist or worsen if blood sugar control remains poor over the long term. Sometimes it improves with better regulation, but sometimes the nerve damage is permanent.
And anything else? Cataracts, maybe? I know that happens in dogs.
Cataracts can occur in diabetic cats due to changes in the lens caused by high sugar levels, but it's actually much less common than in diabetic dogs. So, less of a primary concern, but still possible with chronic or poorly managed diabetes.
Okay, so considering all this, the need for diet, insulin, monitoring, potential complications, what's the overall outlook? What's the prognosis for a cat diagnosed with diabetes?
You know, the prognosis is really quite variable. It depends on so many factors: how early it was caught, how well it can be regulated, the owner's ability and commitment to manage it, whether complications develop.
You're right.
But as we mentioned, the possibility of remission exists for some, which is fantastic. For many others, though, it becomes a chronic condition requiring lifelong management.
Lifelong management.
Yes, usually involving those regular insulin injections, the specific diet, the blood sugar monitoring. It's definitely a significant commitment. But the good news is that with dedicated care and good veterinary support, many diabetic cats can live happy, comfortable lives for years after diagnosis.
That's good to hear. It's manageable with effort.
Absolutely. Quality of life can often be very good.
Okay, so let's try and wrap this up. To summarize what we've dug into, feline diabetes is pretty common, usually similar to type 2 in humans, involving insulin resistance or lack of production, leading to high blood sugar.
Right. And major risk factors include obesity, older age, being male, inactivity, and even genetics like in Burmese cats.
And the signs owners should watch for. The big ones are drinking more, peeing more, being hungrier but losing weight, and maybe that funny plantigrade stance when walking.
Exactly. Diagnosis relies on persistent high blood sugar and sugar in the urine, with the fructosamine test being key to rule out temporary stress spikes.
Management then involves, crucially, a low-carb, high-protein diet, usually long-acting insulin injections tailored to the cat, and weight loss if needed.
And while serious complications like DKA can occur, careful management often leads to a good quality of life, and sometimes, wonderfully, even remission.
It really covers a lot. And stepping back for a second, thinking about this whole discussion, it's kind of amazing how studying these metabolic processes in cats gives us insights into similar human conditions, isn't it?
It really is. The parallels in insulin resistance, the way beta cells can get exhausted, it highlights how fundamental these systems are across species.
It makes you wonder, what else can we learn from comparative physiology? Studying diabetes in cats could potentially help us understand human diabetes better, and maybe vice versa. It really points to this, interconnectedness of health.
That's a really profound thought to end on. And perhaps for you listening, think about the dedication involved in managing a diabetic cat. It really underscores how crucial early detection and consistent, careful management are for the well-being of any creature, feline or otherwise. Something to really consider for our animal companions.
Well said. Thanks for exploring feline diabetes with us today.